Welcome to Physiomobility's Total Knee Replacement Exercise Program for weeks 4 to 6. For the warm-up section, please repeat each movement 5 times before proceeding to the exercise section. For the following week's warm-ups, you can choose either between deep breathing, walking, or using a pedaler for 10 minutes to get the blood flowing to the muscles. Now we're moving on to the exercise portion of this program. For this exercise, you're going to tighten your core and push your back into the floor, squeeze your glutes, and gently lift your hips up towards the ceiling, only slightly off the ground. You also want to make sure you're pressing your heels into the ground as much as possible. For this movement, make sure that the therapy ball is placed directly under your heels. As you drag the ball towards your body, bend your knees in towards your chest, and use the ball as you push back outwards. Take your time with this movement and make sure it is nice and controlled. For this next movement, have your operated leg placed at 90 degrees against the wall. From here, you're going to bend it down into a flex position and slide your foot back up the wall. Use the wall as a guide to slide your foot down and back up. For this next exercise, make sure that the operated leg is as straight as possible. In this position, you're going to lift up towards the ceiling, just under knee height, and back down. You want this movement to be nice and slow and controlled, keeping the leg as straight as possible with toes pointed up towards the ceiling. For this next exercise, using a strap around the ankle, gently pull on the strap to assist to bend your knee towards your body and gently relax it back down. You want to repeat this exercise a few times to get more flexion within the knee. Standing upright, using the back of the chair to help with balance, you want to push your weight back onto your heels, pushing the hips back into a half squat, and stand back up nice and tall. Make sure that you're using your hips first, and then the knees will bend gradually. For this movement, make sure the resistance band is tied against a stable surface before extending the knee completely until extension and then relaxing back down. You want to take your time to extend the knee and relax to resting position. Seated on the edge of your chair, try and push your knee forward to touch the wall and relax back to a seated position. For this one, you really want to make sure to try and bend your knee as much as possible while keeping your heels down on the ground. Please make sure that you are positioned close towards the edge of the chair, sitting up nice and tall as you push the hips back to lean forward with a straight back. Make sure that the operated leg that we are working on is as straight as possible and toes pointed up towards the ceiling to ensure maximum stretch during this position. It's important not to hunch forward. For this exercise, place a small ball in between your knees and squeeze your knees together. From there, you want to extend your leg as much as you can until extension and relax back down to resting position. Make sure to maintain the pressure in between your knees towards the ball. For this exercise, make sure the resistance band is tied against a stable surface. From there, you'll drive your heel back towards your body, creating flexion within the knee, and then relax back to resting position. For this exercise, you'll place a light weight around your ankle. From there, you're going to fully extend your leg as much as possible and come back down to a resting position. Make sure that the weight you use is appropriate for your level. Placing your operating leg forward in a straight position, push the hips back as much as you can to feel a stretch behind the hamstring. You also want to keep your foot in a flex position to get the maximum stretch behind the knee. So that you feel the stretch behind the hamstring as much as possible, make sure that your back remains completely straight in an upright position. For this next exercise, place your operated leg onto a step and slightly bend the knee forward so you get some greater knee flexion. You want to take your time through this movement, gradually place your foot on top, and bend as much as you can. For this next movement, place a stool behind you to place your operated leg's foot on. From there, you're going to rock your ankle forward while also pushing the knee down and forward just slightly so that you can feel a stretch in the front of your thigh, also known as your quadriceps. You're going to repeat this motion back and forth until you feel a sufficient amount of stretch. For this next stretch, place the chair beside you to make sure that your body can get into a lunge position. Your non-operated leg will bend forward as keeping your back leg as straight as possible. From here, you want to make sure that you're tucking your hips under and pushing that operated leg's hip forward. Similar to exercises we have done previously, except this time you're going to place a resistance band around the ankles as you slowly lift your leg away from the body and return back to midline. With a resistance band around the ankles, this time you're going to drive your heel backwards, squeezing the glute to lift your leg behind the body and off the floor, and return back to a resting position. For this last exercise, use a bike to gently pedal forwards and backwards to work on knee mobility and strength. After you've completed 10 repetitions of each exercise, make sure to go through this routine one more time and talk to your therapist if any new problem develops.